Greetings to all. Myself, Dr. Hemant Krishna, Senior Lecturer in Department of Pediatric and Preventive Dentistry, Sri Siddhartha Dental College and Hospital, Tumkuru. Today, I am going to discuss on topic mineral trioxide aggregate. These are the contents I will be dealing with. First of all, in any restorative material, the oral cavity is not an ideal environment because of the moisture control. So here in late 1990s they have introduced mineral trioxide aggregate because of its hydrophilic in nature. So any blood saliva is less ideal environment for any restorative materials because it will if any contamination happens, it will undergo degradation or uh, it will lose. So the bioactive calcium silicate based endodontic material were introduced in early 1990s. Coming to the history part, in 1824, Dr. Joseph Aspin he introduced Portland cement, which contains it's a calcium silicate cement based cement. So then it is later it is because of its less radio opacity. Dr. Muhammad Thorabenjan and Dr. Dean White in Loma Linda University in 1993, they introduced a specific cement called mineral trioxide aggregate with having calcium silicate based material with bismuth oxide. So in 1997, FDA classified it as a class 2 medical device which can be safely used in a oral cavity, whereas it comes to the market under name ProRoot MTA by the company called Dentsply in 1998. Coming to the composition of mineral trioxide aggregate, it contains mainly tricalcium silicate in 53%, which helps in the main strength, helps to build up the main strength. Whereas and also it contains dicalcium silicate, which is 22%, which helps to for the long-term strength. Whereas also it contains tricalcium aluminate, which is in 2%, which helps to early reaction accelerator. And next is silicate oxide and calcium oxide, which is in 8%, which are fillers. Whereas in gypsum, it also contains gypsum, which will helps to alter the setting time. And also it contains bismuth oxide, mainly for the radio opacity, so that we can see where we place the MTA in our pulp chamber or in cavity. Coming to the types of MTA, there are two types of MTA, that is grey MTA and white MTA. First of all, we'll discuss on grey MTA. Grey MTA, which contains aluminum ferrate, which imparts a grey color, and also it has more number of hydroxyapatite crystals, that is 43%, so that it helps to remineralize or secondary dentin formation. So it will induce the dentin more efficiently, but it has one disadvantage, that is gray in color. So they have introduced white MTA. It's a tooth color MTA, whereas it mainly helps to restore the anterior teeth, which it contains smaller particles which has 8 times less than the gray MTA, and also the main disadvantage is it has less compressive strength and shorter setting time. Coming to the properties of MTA, it has coming to the mixing time. MTA is powder liquid form, whereas it is mixed with the distilled water in the ratio of 3:1. That is, powder is 3 and 1 part of liquid. And when you mix the MTA, the tricalcium silicate will mix with the distilled water and form calcium silicate hydrate and calcium hydroxide. So the main disadvantage of MTA is the longer setting time. That is, the initial setting time is 70 minutes, whereas the final setting time is 2 hours 45 minutes. And the initial pH is 10.5 and the final pH is 12.5. So mainly the MTA is higher alkaline in nature, and the bond strength is 7 to 10 megapascals, whereas compressive strength is 70 to 70 megapascals. And the main property is when it releases the calcium hydroxide, it also helps as a antibacterial nature. That is, it helps to induce the reactive oxygen species activity in an aerobic condition. So that the main property are, one is low solubility, antibacterial in nature, and also it has high alkaline pH, that is around 12.5, so that it will induce more second dentin formation. Coming to the mechanism of action, that is, when it mixed with the distilled water, it will release the calcium ions so that it helps to the cell proliferation. That is, mainly it will reach the highest pH, that is basic pH around 12.5. In that pH, it will modulate the cytokine production, and also it will encourage the migration and differentiation of hard tissue from producing the cells, that is multinuclear giant cells. So it will initiate the multinuclear undifferentiated multinuclear giant cells, and it helps to production of more and more of osteoblastic cells. And because of this, there will be a more formation of hydroxyapatite crystals, which will lead to formation of biological seed. Coming to the advantages, the main advantage is it's a high alkaline nature, so that it's a more biocompatible in nature, bioactive and hydrophilic. That is, it requires moistures to set, so that no need of maintaining isolation as compared to the other restorative materials. And it also has excellent sealing capacity. Once you place into cavity and leave it for a few minutes, it will set hard and it will turn into a hard mass, so that it is very hard to retrieve once you place the MTA. And it also has a radio opacity, and it is non-resorbable or dimensionally stable material. The main disadvantage is it has long setting time, handling difficulties, and it's very expensive material, and sometimes mainly the gray MTA will cause discoloration in the anterior tooth. So they introduce the tooth color MTA, that is white MTA, and it is very hard to once you set it, you cannot retrieve the MTA easily. Sometimes if you sometime in cases if it before setting, sometimes if you irrigate or if you place any moisture on the tooth surface on the MTA, sometimes the chances of washout in early stages will happen, and it also has limited shelf life. Coming to the clinical application, how you place MTA into the cavity or in a pulp chamber. First of all, we can use lentular spirals or amalgam plugger, MTA plugger, Gattaparcha plugger, or also we can sometimes there are two systems, that is called MAP system and Dentovan system. Coming to the indications of MTA, that is, we can use in a direct or indirect pulp capping in primary or permanent tooth, and pulpotomy in primary or permanent tooth especially. And here uh, here I can see mainly used in case of open apex cases, that is the procedure is called apexification. When there is no proper apical seal, or in case of blunderbuss canals, if you want to perform root canal procedure, first you have to place MTA on the root end and then followed by the proper obturation. In case of also we can use MTA in case of perforation repair. In case of root resorption or any root fracture cases, also we can use MTA for the perforation repair. And mainly in pediatric dentistry, we use MTA to obturate the primary tooth where there is absence of permanent tooth bud. Coming to the commercial availability, it is available in two forms, that is ProRoot MTA and MTA Angelus. The main advantages of ProRoot MTA are it is cheaper and also it will, but the main disadvantage is it will take 2 to 3 hours to set. So they introduced MTA Angelus. Currently we are using MTA Angelus, that is it requires only 15 minutes to set, and it is available in containers with the less calcium sulfate. Coming to the companies, that is ProRoot MTA, Diaroot Bioaggregate, Endosequence, Endocementa, and also we can use MTA as an endodontical sealer. And coming to the nowadays, MTA is available in a pre-mixed syringe form, that is in putty in consistency. Available, the product name is Biostructure MTA putty, widely used. Coming to the takeaway or conclusion of this my presentation, that is the MTA is a gold standard material in the dentistry, and the main advantages is it is hydrophilic in nature, and it has high pH, that is around 12.5 after the final set, and it has, after many research, it is considered that MTA has long-term clinical success coming to compare with other restorative material, and the biological benefits overlay its limitations. So these are some of the cases what I did. That is, in case of immature permanent premolar, I have placed when there is a caries reach the pulp chamber. We have we have did the pulpotomy treatment with MTA. This is the apexification cases. and this is a regenerative endodontic treatment case where MTA is placed on the coronal pulp chamber. These are the references. Thank you.